Do friends ask you GI questions at dinner?
All the time.
Hello and welcome to Off Script. Here at Oswego Health, we love to take you behind the scenes with the healthcare team that takes care of you. Today, what an honor to be sitting next to Dr. Ali. Dr. Ali, thank you so much for coming on Off Script.
Thank you for having me.
Awesome. So today, I've been looking forward to this because my mother used to yell at me about talking about being clean, digestive issues at the kitchen table. Well, guess what? Today, I get away with it. This is awesome. So sorry, Mom. So let's get started. So what we're going to do, I'm going to ask you a question, and then we're going to see where the conversation goes from there. So fairly simple. Then, once we get through that, I'm going to ask you some rapid fire questions, which are going to be fun and a blast. At the end, those items I asked you to bring in, we'll talk about that, tell you a little bit more about yourself. Excited to talk about a couple of those items.
Sure.
And then make sure I don't forget, you get to ask me a question at the end. So the hot seat turns from you to me. Cool?
Sure.
All right,
Sounds
let's
like a
rock.
plan.
So since moving to the area, have you found any favorite places in Central New York?
So I've been in Central New York over the past 6 years. So any spot, any lake, any park in the Finger Lakes region, is a place that I love to be, especially during the spring and summer months. Yeah. And,
So any of those places in the Finger Lakes?
any of those, Lake Seneca or Skinny Atlas Lake, because I was in Cortland before and now I'm in Manlius. So 15-minute, 30-minute drive, you can always get to a beautiful park like Green Lakes Park, or you can get to a lake or a place to eat or a hiking spot. So yeah.
Canandaigua, I love.
Yeah.
It has New York Kitchen. So you can go there and they have all the Culinary Institute. So you can go there, they can teach you how to make all sorts of cool stuff, and they have wine pairings. It's a blast.
Yeah.
I love it. Yeah.
Yes.
So go there one time if you should.
Will do.
As a gastroenterologist, do people ever expect you to have that perfect diet?
Yeah. I mean, people always ask me, what do you have for breakfast? What do you have for lunch? And what do you have for dinner? What I try to tell them is what matters at the end of the day, especially now in the age of these fad diets, high protein, high fats, low, carbohydrates, Atkins diet, and, the paleo diet and whatnot. So I think what matters is finding that balance. So I tell them that, it doesn't matter what I have, I probably will give them a sample. For breakfast, for example, I would say, I probably want to have protein and fiber when I'm starting off in the day. But, it doesn't have to be protein from a specific source or fiber from a specific source. Whatever you want to have eggs for your protein, that's fine. If you want to have a protein bar to get your protein, that's fine. If you want to have, I don't prefer meat for breakfast, but if you want to, if that's your protein source, but having some kind of protein might be a good thing at the beginning of the day. Having some fiber, good for your colon, good for your digestive health as well. So yeah.
Awesome. So medicine can be demanding. What helps you recharge outside of work?
A lot of things. So, I have a lot of hobbies outside of medicine. Sports is, of course, a hobby of mine. I love sports. I played cricket quite a bit, soccer quite a bit growing up. But, I also love basketball. I love football. And so whenever I get a chance, either be it playing with my daughter or playing with my brother-in-law, or even with colleagues, we're planning on starting a pickleball league over here because, that's very popular. That's definitely an outlet for me at the end of the day to kind of relieve my stress. Other than that, I love to cook, at home, either assist my wife or cook by myself.
What's your signature meal?
My signature meal, I would say, is a type of beef stew or curry that I will make, once in a while. It takes a lot of preparation to do it, but when everything is said and you have somebody assisting you, I would say that's something that I think I make a pretty good beef stew.
I love beef stew, so I have to invite myself
Sure,
over. Yeah.
anytime.
How much different is cricket from baseball?
Cricket and baseball, they're very analogous. I think there are a lot of similarities in terms of pitching. We have what we call a bowler, but there's pitching. Same thing with a batter. The bats look a little different, but you have 6 runs, which is kind of like the home run when you're playing baseball, and you have runs that you can steal, going between bases instead of like the 3 or 4 bases that you have, the diamond shape, the cricket field, the actual pitch that they call it is rectangular in shape. But you can get runs, you can run runs, and there are various ways that you can get caught out, like you catch the ball. So there are a lot of similarities.
There's no glove though; it's your hand, right?
When you're batting, you do have a glove. When you're
Okay.
bowling, though, you do not have a glove.
Okay.
So that's where the difference is. But there's like a kind of like a somebody who's catching, what we call a wicket keeper, that catches the ball behind the batsman, just like you have in baseball. They have a you have a mitt versus a glove.
Okay.
But yeah, the bowlers do not wear any gloves, or the fielders do not have any gloves.
Right.
Yeah.
Yeah. I joined a fantasy cricket league a couple years ago. I came in dead last. Dead last. I gotta ask you for now. Yeah, no clue.
I love
no
cricket,
clue
yes.
whatsoever. Do you think having interest outside of medicine helps you be a better physician?
Oh, absolutely. I just mentioned as far as like sports is concerned, the reason why I love sports is I see a lot of these values, like teamwork and resilience that resonate with me, not only, outside of sports, but also in my work life and also in my personal life. So I think that it is, I don't want to sound cliched, but it's character building in a way, because I draw a lot of analogies to those times when when I'm playing, and I tend to be pretty competitive, and I always say the game is not over till it's over, right? You're like behind, but it's that last minute, and what can you do to kind of get that shot off, or to kind of like strategize and make the most use of that time and resources to get a W. So yeah, I think there is a lot of analogies that I see between life and sports.
Yeah. Do you see similarities between, the sports characteristics in when you're actually doing a procedure, for example?
Yeah, I do see. I mean, in sports, it's all a matter of like milliseconds and seconds and minutes, and how you can get better by repeating through practice, through strategies, applying all the different resources that are available to you. To a certain extent, I see that in my day-to-day life, be it, making sure that the workflow in the clinic, like getting to see all the patients on time, doing, putting in the right orders for them, the right tests for them, scheduling them for procedures, doing them in an efficient manner. I kind of see a lot of, analogies with like how you try to be efficient in sport. And I see the same thing, when doing procedures, right? Because it's a workflow. You want to be efficient. You want to make sure your team is on the same page as you are, and they're all pulling together in the same direction, with the patient being in the center of all of this, right? Do the best by the patient so they have the best experience, when they come for a procedure. So yeah, I do see a lot of parallels there.
Awesome. Your journey to me is absolutely fantastic. We'll talk about schools you've been to,
Sure.
where you graduated from, coming from New York, downstate New York City. Love to open that up a little bit. Tell us a little bit about your journey getting to here in central New York.
Sure. And yeah, my journey is not the typical journey. I was born and raised actually in Dhaka, Bangladesh, and I immigrated here with my family in 2000. But when I look back upon, like, from high school, I did a few years of high school here in Bayside, and then subsequently in college, and residency and fellowship. I always see that I've kind of like pursued like excellence and meaning in whatever I do. It started with Bayside High School, and then after that I went to Columbia College for my undergrad. Went to Stony Brook for medical school, and then did my residency, my chief residency fellowship in what is now NYU, Langone, Long Island, and that journey continues. I will be doing the physician's executive program at Stanford University later this summer, as part of a group of physicians that are getting together to kind of get an understanding of the business side of medicine and the non-medical side of medicine, to kind of help us do what we do. Look at AI and how that is going to impact the healthcare landscape and things of that nature. So even outside of the training part, I've always like looked for these opportunities to be a leader and to have impact. So I'm very involved in the American College of Gastroenterology, where I'm a fellow, the American Society of Gastrointestinal Endoscopy, where I'm a fellow. I'm trying to establish a social media platform for educational purposes, for outreach. So in all these different steps of my life, I've kind of seen like I gravitate towards things where I can have an impact, do something that's meaningful. And that is kind of also one of the big reasons, how I ended up coming to Oswego, because I saw this as an opportunity to grow, an opportunity to have an impact in the community, make a difference in people's lives. But the thing was also, leadership. They saw the vision I had, they shared in that vision, and we had aligned goals. So I think, one thing led to another, and it was that perfect fit, which ultimately brought me here to Oswego Health. And it's
Awesome.
been 3 years
Yeah.
almost this
You have
March.
no idea how exciting it is for me to go out into the community and tell everyone Dr. Ali did his residency at NYU Langone. It carries so much weight. It gives a legitimacy to what you're doing. Obviously, you are a great physician. It helps out quite a bit, which is fantastic. You talk about leadership. That means there were mentors in your life that guided you. Tell me about some of those encounters and some people that you look up to today that guided you to where you are today.
Mentors have played a huge role in my life, where I am right now. People always ask, like, how did you choose gastroenterology? Because in order to be a
That was one of my
gastroenterologist,
questions. Yeah,
right?
yeah, yeah, yeah.
Oh, you start off as in medicine, in internal medicine. And it so happened that, second year, when I was at medical school, the second or third year, they hook you up with a physician.
Mhm.
In the medical school, so they can guide you, advise you and help you. And it just so happened that her name was Dr. Halwan, and
Mhm.
she was a gastroenterologist. And at that time, it was Winthrop Hospital, so it went through various phases.
Mhm.
You mentioned when I was at Stony Brook, I had the opportunity to train at Winthrop. It was one of the teaching hospitals of Stony Brook, and subsequently merged with NYU Langone, and then became NYU Langone Long Island. But that mentor, she was kind of like that constant force throughout, and there were other mentors, as I went along. But it just so happened that she told me, hey, you know what, I have a few opportunities for research. Would you want to come and help me out? So that was, the serendipitous way of me kind of getting this exposure to gastroenterology early on. Like, see how there was like the procedural aspect of gastroenterology, how it's not like, it's a multifaceted field. It's not just looking at colons. You can study about the pancreas, you can
Mhm.
study about the gallbladder, you can study about the esophagus, which is something that I did additional training in. And then you can also look at the large intestines, the small intestines, and things of that nature. But it was through her that I got to see the world of gastroenterology, that I got to get involved in research. And then subsequently, I've always kind of whoever, whenever I was in fellowship, in residency, I always had people that were doing things that I wanted to do. And I always thought of them as assets. But what ended up happening was, they became like, these almost like family to me. And, you build these lifelong relationships. And I still will meet them when I go to these national conferences. And it's kind of like revisiting. And even now, in front of them, I am kind of like their mentee. So they're like, we are colleagues right now, but to them, for me, given the impact
Mhm.
that they've had in my life, because it's stressful, right? Going through all that training, it's 12 to 15 years of training just to get here. So you need a lot of support. One of the things that you mentioned, outside of work, is family. Family is very important for me, because you need their support to do what you're doing.
Mhm.
It's a very busy lifestyle. When I was a fellow, I already had a little kid. My daughter, who is in ninth grade right now, she was born and at that time I was a resident. And, to balance, like, a little
Oh, yeah.
child, a family, my wife was working full time, I was a fellow, a resident, it's very difficult. So, you need that support, you need that mentorship to kind of like get to where you need to. So, they kind of pick you up along the way
Yeah.
and show you that there's light at the end of the tunnel.
Yeah. You mentioned research a little bit.
Yes.
It's something I wanted to dip into with you. It's something you're constantly doing. Is there a correlation between, the research part of medicine and then actual hands-on in-clinic care?
Yes.
Yeah.
So I think it's one of the buzzwords right now in medicine is evidence-based medicine.
Yeah.
Right? You hear that all the time, in the news, when you're talking with other providers. But when we talk about evidence, the source of that evidence actually is research that somebody
Mhm.
did. So whenever I would, have a question, that I could not get an answer to, that would be the start of, that has been the start of many of my projects that I've done, where I just had a simple question related in GI, and I was like, oh, I'm not getting a sufficient answer, or they looked at this part but not necessarily this part. That was kind of like that spark that led me to do a lot of the publications that I, subsequently had, be it an abstract that I presented at a, national conference, or something that I published. And so I think research plays a critical role, because whatever we do, we want to be guided, like I said, by that evidence, which essentially informs what standard of care is. So I had the opportunity to be on the other side of it, doing the research that eventually, the hope always is that, it leads to results that can improve the way we take care of patients. And now that, you're on the other side, when you're a physician, you also depend, you look at the studies, you look at the guidelines. We're talking about like how the screening age is now 45. It used to be 50 before.
We'll get to
and
that.
we'll
Don't
get to
worry.
that.
We'll
But
get
that
to
was
that.
like
Yeah,
all that research that informed, that recommendation. So, I advocate for that. I look for that all the time. And that's why, as a physician, you're a lifelong learner, specifically for that reason, because things that you might have, known 5 years ago based on the research at that time, might have shifted with more data, with more information. So it's a critical part of what we do, because we want to provide the best care. Again, at the end of the day, we want to provide the best care to our patients. And so best care equates to, the best research informed care.
So since we brought it up already,
Yes.
it's on the top of my brain.
Yes.
Let's talk colonoscopies in colon cancer.
Sure.
Yeah.
All the spotlight is on colorectal cancer or colon cancer. But the reason why I think it's justified also is because of the rise in, colorectal cancer, especially in the young, folks that are less than 50 years. And I know that before we were talking about this big study that was published, earlier this year, where they looked at more than 1 million plus
The
cases.
numbers were astonishing.
And now it's the number one cause of cancer death in people, under the age of 50. And it seems like the mortality associated with it has been climbing steadily over the past 20 years. And we don't really have a clear answer. So what we are leaning on is efforts to, do our best when it comes to prevention. And it is one of those diseases where, screening, the gold standard being colonoscopy, not only detects, but actually prevents cancer. And so that's why, I preach this message wherever I go of screening on time, and screening using the various tools that are available to us right here in Oswego, right here in our community, be it a stool-based screening test with your primary care doctor, or a screening colonoscopy with me here at, our hospital. So, that is taking, more and more of center stage. And, recently we've had some celebrities unfortunately pass away at a very young age, which has brought, this attention to this disease. And I think that that attention will keep growing. And, as we look for more funding to try to get to the bottom of, why this is happening. But till we have a clear-cut answer, I think, screening becomes indispensable. Screening on time, knowing risk factors, being aware of symptoms that should, prompt you to visit your gastroenterologist and get further workup. And so, yeah.
And then you talked about,
Yeah.
promptly. Let's talk a little about the direct access that we have here at Oswego Health.
Yeah, thanks for bringing that up, because I think that really places us, as a standout when it comes to a community hospital being able to offer that. So this direct access screening colonoscopy program allows individuals really to schedule their screening, healthy individuals to schedule their screening without having to do an initial GI office visit. So we work with our community partners, our community providers, and kind of have these patients be scheduled for a colonoscopy without needing an extra referral and then waiting to be seen in the clinic, but show up in the, the endoscopy unit, and we take care of everything else in the background, going over the bowel prep, the stuff that they have to drink to ensure that they flush out their colon, what they can expect the day of the procedure, the modified diet they have to be on the day before the procedure, and, what really happens during the procedure, after the procedure. All of that we're doing without having to, waste the patient's time and energy and money to
Yeah.
come into the office and come through multiple visits where we streamline the process. And we started just over a year ago. The last I checked, there were already more than 70 patients, and that number is growing because now we have opened up
Open it
this
up to the
program
community.
to everyone. Before it was like providers in the community but affiliated with Oswego. Now it's any provider can take advantage of this program and send them over to us.
Yeah, the early conversations I've had so far, especially patients who are coming from a distance away, not having to come in for that appointment,
Correct.
just going directly to the procedure. Everyone has such positive feedback.
Yes, patients have given us a lot of positive feedback, and I think that is helpful, especially because, like I said, everything that we do here in Oswego, we look at the patient, and we are like, how can we do better for our patient? How can we make it easier for them? And I think that has been a hit, and I think it will just grow exponentially over the next year.
I know colonoscopies and colon cancer are a large aspect of gastroenterology, but it's not even close to being everything.
Yes.
And I know there's something hits home with me personally, with my family.
Yeah.
Irritable bowel syndrome, or IBS. Talk a little bit about that.
Yeah, so thanks for bringing that up, because one of the things as director of the Center for Gastroenterology and Metabolic Disease, I always try to educate and outreach, and I tell my whenever I meet individuals in a group that we at our center do everything. GI is not just colonoscopy, but it includes things like irritable bowel syndrome, inflammatory bowel disease like Crohn's disease, ulcerative colitis, peptic ulcer disease, problem swallowing, problems with bowel movements, constipation, diarrhea, gas, bloating, problems of the
Heartburn,
pancreas,
heartburn.
heartburn. We treat all of that. So GI is a very, very, very big field. And so we do, essentially almost all of it at our center, with the help of our advanced GI doctors, and with other doctors that will come and practice with us. We have a bariatric center here that we work with, for liver disease, for example, for fatty liver, hepatic steatosis, the medical terminology for that, hepatitis B, hepatitis C. But to specifically go to the irritable bowel syndrome, which I think is actually one of the type of patients that we take care of, what we call functional. And, we see a lot of these patients that have been to 2 or 3 other offices, 2 or 3 other gastroenterologist
You're
offices.
talking to one of them, yeah.
And, they come in as like a second or a third or a fourth opinion. And these patients have undergone a lot of workup and nothing has really shown. And they tend to be very frustrated. Their lives have been impacted. But these are also the kind of patients that I think that come to Oswego Health because, our first goals, as a center here, as somebody who is the chief of GI, is that we want our patients to feel like they're being heard.
Yep.
And, we want them to feel like they're treated with respect and dignity and compassion. And I always say 3 A's for staff in my clinic. Whenever we do a huddle, I always say we have to be approachable, we have to be available, and we have to be affable. Right. And those are the 3 A's that I always use for staff in my office. And because at the end of the day, a patient, we want to make the patient feel that we're not looking at them just as a compilation of signs and symptoms, but as a whole person. And, during my 3 years here, that is what has led to, patient becoming almost family. Or like family. And we have these like lifelong relationships that we built. We'll have patients that I might have seen 5 years ago or 6 years ago that I'm still seeing, that that are coming to see me
from previous locations
that are coming. And now we are attracting patients from even further out. We have patients coming from Watertown. We have patients coming from Binghamton. Part of the reason also is because the efforts that we are making through programs like the direct access screening colonoscopy program, where they're coming to us just because the wait time in other places, other clinics, are much longer. And so you get that feedback in real time, because they're literally telling you that, hey, the reason why I'm coming is because I have to wait 6 months or 7 months to get a screening colonoscopy somewhere else. So I think that the IBS patient kind of encapsulates that patient that has had a lot of workup done, has a lot of symptoms. It's very complicated, very layered, and they really need somebody who is going to take care of them in the long run, provide them with that care where they feel like they're being listened to, and that they feel like they're being validated. And so it's a good thing that you brought up that question, because we do take care of a large part of what we call like under the umbrella of functional disease, and we do that
During that
clinic.
one answer, you answered two of my questions, but we'll get back to them.
Sure.
So the first one was that wasn't a question, but it was just something I noticed with the sports you talked about earlier, and you mentioned you huddle every day. So
Yes.
I thought,
Yes,
I
the
took that.
huddle.
I go, that's
Yes.
awesome, right?
Yes.
And then the other one was you mentioned it a little bit of it, but when a new patient comes to see you, what are they going to expect? Yeah.
So I think the first thing that they can expect is, I know that when you get these patients, a large portion of these patients are referrals. So you have labs that they had done before, imaging that they had gotten done before, procedures that they had gotten done before, and so before I go into the room, there's all this information that comes with that patient, and I read through all of it. But when I walk through that door, I always tell my patients that you're a clean slate. It's a clean slate. I know all of that for context, but I'm not gonna, verify anything from you. I want you to tell me your story. I don't even go and tell them, oh, you've been referred for symptom A or B or for this.
Okay.
I tell them, what brings you here? How can I help you? And a lot of the times you will see that the way the information was presented in the referral, documentation is very different than why the patient is there. So I think that what they can expect is that we will objectively assess, we will listen to their story, we will not be biased given the information that they're coming in with, and silo them into a specific diagnosis, but consider all the differentials and kind of assess based on what the patient is telling us, not necessarily what happened before, and then kind of try to understand what their expectations are. One of the main things is, what is the expectation of the patient? And that is a very subjective thing. You'll have two patients with the same symptoms that will come to us. One patient will say, doc, this is my expectation. And another patient will say, this is what and they can be, very, very different. So my first goal is to be able to deliver on that expectation, or at least give them a plan. What they can expect also is, like, all the decisions we make are going to be shared decisions, right? Because my job as their gastroenterologist is to tell them what the evidence states and what the differential is given their symptoms. But at the end of the day, as far as the plan to treat, the plan to have additional testing, to come to a definitive diagnosis, is going to be something that always tends to be something based on discussion. So that is something that they can expect. As I mentioned before, that we treat them with respect, we treat them with dignity, because when these patients are coming and they're having GI symptoms, and a lot of my patients, it's impacting their life, right? I'll have a bus driver who cannot drive the buses anymore for their kids because their GI symptoms are getting in the way. We will have other doctors that cannot provide the care they want to provide because of the symptoms that they're having. So the first goal is, how can we improve their lives? How can we get them back to functioning while we come up with a plan, while we take care of them going forward? So when people come to me, that's the first thing that we talk about, and that's where the expectations come in. And how can we get, what are your expectations, and this is what we can do, this is what the plan is. But transparency is a big part of it. Because I do not make any decisions or order a test or perform a procedure where the patient does not know exactly why we're doing it. And the same thing also applies where there are complicated cases where, I'm not really sure what's going on. But what my patient can expect from me is, we will have that conversation, right? That, I might not have 100% clue as to what exactly is causing this. These might be the things. And I've seen that, patients really appreciate when they know that everything that we're doing, that they know why we're doing it. And it's not just, me telling them that this is the test you're going to have, or this is the procedure we're going to do. I rather try to take the approach that, I think this might be going on, and this is a test that we can do to further confirm. What is your take on it? What do you think about that? Same thing with procedures.
So you're having very serious conversations with these patients where, I know enough of some of these, diseases where, like the bus driver, for example, they're having a hard time. They're thinking about going to the bathroom. The concentration is off the road. It's just very serious conversations. Of course, we laugh, of course, because of potty talk, right? But
Sure.
it's serious conversations,
Yes.
serious issues. And it's nice that you roll it back into what you talked about earlier about the research, right? Just it's good
Yes.
stuff there. Yeah.
Yep.
Yeah.
And like you said, like I mean, when it interferes with their lives and their functions and they can't keep going on, they're also in a very vulnerable place for these
Absolutely.
patients
Yeah.
when they come in.
These
And
aren't
so
topics that people really want to talk about.
correct.
Yeah.
And there have been patients where they'll be like, Dr. Ali, I've spoken with you about things that I have not even
Yeah.
spoken to my parents about or my
Yeah.
children about or my significant just because, I felt embarrassed.
Mhm.
And I think that our clinic kind of provides them that space and that privacy and that trust where they can, feel like they can talk about those things. And I think at the end of the day, we build everything based on a good story. The more comfortable the patient is, the more they can tell us what's going on, the more they can be descriptive. I think the better it is for us because there are clues all over the place in that story. So the better we can extract a story from them, the more comfortable they feel in telling us about that story. I think that the more empowered we feel as physicians as to like we kind of get a sense of what's going on and be more have more conviction in that differential that we come up with.
So I'm going to change it a little bit.
Sure.
Back to Oswego Health.
Mm-hmm.
Why did you choose Oswego Health?
So Oswego, I always say that, when I was in this all started just to give you a little bit of context. It just so happened that one of our colleagues in Cortland, reached out to me and they were like, hey, you know what, there's an up and coming hospital, Oswego. They're doing great things over there and they are trying to grow in the community and they're trying to establish a gastroenterology service. There was Dr. Roy, who is very well known in the community in upstate. I say he's a legend. He has trained many of the doctors that are practicing in the upstate area. And so I just said, out of courtesy to that other gastroenterologist that, I'll go and I'll talk with leadership and I'll go and I'll visit this area and see what they're doing. What ended up happening was, like I said, a lot of the things that I value, right? I saw those same values at play here. The same vision that the leaders over here, that leadership over here was trying to implement and enact. And so what initially was, let me go and check it out and everything sounds good on paper, subsequently became, wow, this is a place where I can have an impact. I will be able to lead and grow. But the most important thing was help the people in the community. Because the question I always ask is, will I be able to have an impact in my role as a gastroenterologist? But what is also the needs of the community? So when you look at the needs of our community and what we are able to do, what they were doing before, they were driving 40 minutes, an hour, 2 hours to go see a specialist. People in our community, they were traveling to Syracuse or even further. So when I saw that opportunity, and then when I saw that how my goals of a position like this aligned with the goals of leadership, and at the end of the day, having that meaning, doing something that's meaningful, I think is what brought me to Oswego.
There's so much going on in this specialty, which means there's probably misconceptions. So, what are your biggest ones that you see?
I'll go over some myths related to colonoscopies, which are the gold standards, a gold standard for diagnosis and prevention of cancer. One is that, it's very painful. Colonoscopies are very painful. And I tell my patients that the vast majority of patients report, to have little or no pain, especially because we do the procedures under sedation, monitored anesthesia care where they're sleeping and there's an anesthesiologist monitoring, how their heart and lungs are functioning during the procedure, but they're sleeping while we do the procedure. So there is no pain, there is no discomfort. Some other ones are, colonoscopy is very dangerous. I've heard in the community, they think that, there's a lot of, side, complications that might be associated with colonoscopy. And I tell them that, that is not the case. The risk of severe or serious adverse effects or complications are very rare. And, on a scale of numbers, like, if we were going to talk about bleeding, we were talking about like maybe 3 cases out of 10,000. If you're going to talk about, I think that's for perforation actually, where there's injury to the wall of the colon. And bleeding is also a very low number, like I think between 10 and 12 per 10,000 cases. So I say that, that I try to reassure them and calm them and say that colonoscopy is not a dangerous procedure and the chances of having serious complication is very rare. And then another myth is, colonoscopy only detects cancer. And it's one of the very few screening exams where we can also prevent, and that goes to the whole thing of removing polyps, which are the growths in the lining of the colon, which in most cases are like how have the start of something that progresses and becomes cancerous.
It's
And
rare
so
to have
by
a procedure that does both.
that is
Yeah.
true. Rare to have it, and research actually shows how these have reduced mortality, where they looked at these procedures to remove polyps. You're like literally taking away the chance of that polyp to become cancer. So you're reducing, in a sense, if you think about it at a very simplified scale, of progressing cancer, of developing cancer from that.
So, Dr. Ali, this brings us to our rapid fire questions section. Are you ready to go?
I think I'm as ready as I'll ever be.
That's the spirit. Right? This first question, I think, is going to be tough. New York City pizza or Central New York pizza?
That is a very difficult question. I would say it depends what kind. If you're looking for a deep dish or thin crust, because there are some places that have popped up in Manlius where there's A&W Wonder, I think, close to
All
where
Who
we live.
Wander. Yeah, that's pretty good.
Yes, their pizzas are
It's very
pretty
good.
good,
Yeah.
and it also depends where in New York you're getting your pizza. So I kind of have to say the jury is out there. I think probably people will say New York City, but having stayed here for 6 years, I think there are some places where their pizzas are actually pretty good, pretty fresh.
I will concur with your statement. Most common question patients ask you.
Most common question: how did you decide to do gastroenterology?
Is it
Especially
really?
when they come for a colonoscopy. How did you decide that this is what you're going to do for the rest of your life? And that, I think, kind of goes along with that myth where they're like, they are just thinking I'm just doing colonoscopies.
Most underrated healthy food.
Most underrated healthy food, I would say, is kiwi, which is a superfood, and it has a lot of benefits. From helping you sleep better to lessening oxidative stress, high in fiber, you name it. It's pretty underrated. We hear about the blueberries and blackberries and a lot of other superfoods, but maybe kiwis not as much.
Central New York winters or New York City summers?
Central New York winters and Central New York summers. And there is a reason. So you might think I'm crazy.
No.
But part of the reason, I think, is, when I first came in, people are like, we will see, how you do during the winters. And so there is this fear, oh my God, the winter is gonna somehow prevent me from doing what I need to do. It's gonna impede, me functioning, taking my daughter to school or me coming to work. What I realize is people are so resourceful that it doesn't matter. It could be a foot of snow at 6 o'clock in the morning. The roads are clean, and all the patients show up for their procedures or for their office appointment. But there's also that beauty of winter that I have gotten to experience in Central New York, because when you see the snow falling and the pristine snow falling, it's a sight to behold. In the city, there might be much less snow, but they kind of get lost with regards to how they want to handle the snow. It gets like, slush and muddy and dirty. You don't really get to appreciate. Winter becomes like, oh my God, like, I don't want to deal with winter. And summers, no question. Upstate is the place to be. I that is not even a competition, especially if you like, outdoors and if you like nature. We will go out hiking, we'll go out biking, by the lakes. It's a concrete jungle, and that has its appeal to some people, but for me it's not even a question. I love summers here at Upstate.
Most rewarding part of your job?
Most rewarding part of my job is when my patients come back and they thank me, and when they say that I could not envision that I would ever be in a place where I would get to experience normal, because for me, my normal was with the symptoms that I lived with for years. To hear that, even though we take her, it's surreal every single time, because it comes from the heart, and then we have patients who are also dreaming of us from time to time. So that's fulfilling as well. You have an impact on their lives.
Favorite way to spend the day off?
Spend time with family. That's I have I'm a girl dad. I have two daughters. One is in 9th grade and one is just past 2 years old, and I love to spend time with them on my day off with my family.
Good answer. Do friends ask you GI questions at dinner?
All the time. Friends, strangers, if they somehow find out. I think it's just part of the reason is because GI covers such a vast spectrum of things that chances are that if you ask a few questions or you start having conversation and they find out that you're in this field, they'll be like, I know, but just wanted to ask, can you confirm this is what my other doctor said? So, and I'm happy to help because, that's part of who I am. I love doing this, so I have no problem answering those questions.
Dr. Ali, you survived rapid fire questions. I appreciate it. I
Thank
did
you.
ask you to bring some items in that
Yes.
represent you.
Yes.
You mind going through a couple of those? with
Yeah,
me?
sure.
Fantastic. Well, the first one, obviously. that I
Yes.
pick up is this
Of course.
lovely
the Bills.
football. Look, the
Yes.
Bills.
Yes.
Oh.
How, look at them Bills. Yes. So, I actually became a Bills fan when I first came upstate in Cortland. And I think part of the reason that resonated with me were listening to the players talk and their background. One of the things is it's a small market, right? It's not like a New York Giants per se that's in the spotlight, yet they were doing amazing things on the field, going to playoffs every single season, giving us all these hope that maybe we'll go all the way. And I think part of that is because of their discipline, of their teamwork, and to a certain extent of all the things that they're doing in the community. And I think it gets amplified more in the upstate where there's all this community need, and to see, these players giving back, not just because, it's kind of like a fad where, they're making all this money giving back, but actually they care about the community. That, stuck with me. And I think that I have to the point where when they lose, it actually hurts me. I actually get very depressed as, why did they lose? Because, they have all this potential, but, they have also given me a lot of great memories over the years where I was like, wow, like what a play. So Bill's a big part, and, hoping that things turn around and we take that next step and win the Super Bowl in the near future.
For you, I'm a Giants fan.
Giants
So we'll move on. No, just but no, the Bills to me, in your answer, you could kind of compare it to a Sweet Health.
Sure.
Right? Yeah.
Of course.
We're not in the big market, but look
Yes.
at what we're doing.
Yes.
That kind of stuff. Yeah. But then, little Columbia.
Yes.
That's
So
awesome, yeah.
yes, so it's a big part. I'm very active in their alumni association. Undergrad education is very important. So the formative years of my life to get a well-rounded education. And like you had mentioned, like mentors, those mentors that I had who guided me, inspired me. So it's a big part of who I am, and I'm thankful that I got the opportunity to be able to go to this prestigious institution and be able to call it, one of my alma maters. Yeah.
That's awesome. Isn't their mascot like it's a lion?
It's a
right?
lion.
Is it?
Yes.
I get bonus credit for getting
Yeah,
the
lion. Yeah. And baby blue. You can't go wrong.
I believe family picture, right?
Yes.
Yeah,
So
yeah,
this was
yeah.
like the family pictures. As you can see over here, this was like when my little one was just 1 year old. Amani, that's her name. This is now she's in 9th grade. Anissa, my wife. And like I said, we love the outdoors. So this was like on another random spring summer day. This is how beautiful it is outside. So I'm thankful for family because I wouldn't be here without them, without their support. Because like I said, GI is a very busy field.
Yeah.
Having to take call, you might get called at crazy hours of the night, crazy hours of the morning, and you have to be ready to come and take care of your patients. So it would not have been possible without their support and love, for sure.
And the next one, I could take it
Yes.
back fast. You mentioned a couple times about,
Yeah.
you mentioned a minute ago, outside, right?
Yes,
Yeah, yeah, yeah.
yes.
So the next one, I think this is pretty cool. It's the New York State Finger Lakes.
Yeah,
pretty
it's the
sweet.
Finger Lakes. It has all the lakes. It shows the length and their depth, which I thought was really cool. But I think that this kind of encapsulates, because when we came to the Finger Lakes region, we were like, oh, what are the lakes around here? Like, and every year, every summer, especially during the pandemic, when people were holding their homes, we got the opportunity to explore, go to all these lakes. I'm a big fan of hiking and nature in general. So I think this kind of is like one of those things. And when I saw this, I was like, I'm getting this, because this is just such a nice thing. And this kind of reflects like that journey when we first came. I think there are a few one or two other lakes that we haven't been to, but I think the vast majority of these we have already visited and keep on going back over and over again. So, kind of becomes like a summer tradition for us and our family.
Do you have a favorite trail that you hike?
My favorite trail that I hike is the one by Green Lakes because, it has
yeah,
kind of like the lake
yeah.
has this green emerald color.
You
And
go
it's
around
kind of
it.
like you
It's-
can go.
it's
It's
busy.
it's
I
an
love it.
easy loop
Yeah,
to do.
yeah.
The views are amazing, and it's just a magical place to be.
Yeah. Now we talked about all of that.
Hmm.
I appreciate you coming here today so
Sure.
much.
Thanks for giving me this opportunity.
My
Yes.
gift to you is you now have the opportunity to turn the table back on me and ask me any question you want to ask. A couple guests have had on so far. They like to hold the off script in their hand when
Yeah.
they ask the question. You don't have to. You can.
No, I would.
there
I
you go.
want to.
Feel free to ask me.
I'll keep it
Anything. Obviously, that's my script for you, but
Yes. So the question that I wanted to ask was like, and we had spoken before where you kind of told me about
like,
all
like,
the
like
various
serious.
the all the various life experiences that you've had. And what I love about that is how different they were and how you kind of like draw on all these different strains that are very different, but you kind of pull them together. But my question really is, when you have all those different experiences and you come to an organization like Oswego, how do you kind of like pull on those experiences to kind of do what you're doing here?
That's a good question. That's a real good question. My leadership, right? Jamie and Jen give me the ability to utilize all of those, right? And a lot of the time, suggestions they make, I don't even think of. And I'm like, oh, yeah, I remember a time where we did XYZ because somebody just mentioned, a possible idea. And of course, it's true. I know people, it's very cliche, but any idea matters. There's no bad idea. Well, they actually mean that. And there's been some times where the four of us have brought something forward. You'll think about like, I don't know about that. And like 10 minutes later, they come back to it and go, maybe that was a good idea, right? And it comes from all four. So I think we are, as Jamie says, a smaller team, small and mighty, right?
Yeah.
We're a great group of four of us that all come with many different experiences, which molds together really well. So
That's a great answer. And I think I understand what you're saying because I see the same thing across
I think
in
it's
the
Oswego
hospital.
Health
I
as
think
a
so.
whole. Yeah. Dr. Ali, I appreciate this so much today.
Thank you. I love this conversation. Yeah, sure.
Hopefully we can sit down again.
Yes,
This has
yes,
been fun. Yeah.
yes. Thank you for having me.
talking about things I can't talk at the kitchen table.
Right.
Look, take that, Mom.
Yes.
Like, yeah, I like that. Yeah. So this has been another episode of Off Script. This is Oswego Health. We'll see you next time.